Hello, I'm Ken Orman. I'm with Health Matters Dental Wellness, and I'm sitting here with Dr. Doe of Miller Dental.
Yes,
is that right?
For having me here on the show.
Thank you for being here. So, where are you located? Where is Miller Dental?
We're near A20 and I-20 in East of Fort Worth.
In East Fort Worth.
Yes.
I see. So, tell me a little bit about your practice and how you got into it and why you're a dentist.
I've been practicing since 2003, and I got into dentistry because of my grandma that I grew up. She doesn't have teeth, and she always struggled with her teeth and her smile. I never seen her smiling, and every time when she eats, she always have to grind up her food. So that's why I want to become a dentist, to make her teeth.
Now, that's very personal. That's a very personal why you became a dentist. So were you able to help your grandmother?
Well, by the time I get out, she passed away. So I just used that passion, and then I service the patient around me that need my help.
Sure. So there's other grandmothers out there.
Yes.
Right. Now,
My grandmother, mom, dad, everybody.
Everybody. So tell me a little bit about your personal experience with your patients. You had mentioned before that you treat them like family. What does that feel like?
By the time they step into my door, they are part of my family. So I would, explain to them everything that they need to know about their teeth, and be honest with them, and find a way that I can help them.
Sure.
Overcome the obstacle.
What kind of obstacles?
Mostly fears, pain, and financial issue. So we find, if they have fear, then we have different way to calm them down, like nitrous and or sedation. If financial issue, we have different payment plan that we can offer, so that patient can just pay monthly.
Oh, I see. So your office actually finances the work that you'll do for your patient? Yes,
we have financial companies, different one, that can help the patient to finance their smile.
I see. So they're just making a monthly payment, just like they would a car or credit card or whatever.
Yes, because a lot of time they don't have the money up front, right?
Sure.
So by the time we tell them to save it up, it takes too long, and all this time patient will be suffering.
Right.
So
with pain.
Yes, with pain or with not confident with a smile.
I see. Yeah, embarrassment.
Yes.
Yeah. You see a lot of patients for that?
Yes, we see a lot of patients that need help with financial issues. So once we have the payment plan we're able to help a lot of patients.
So you help everybody. Right? Your grandmother didn't have the money to get her teeth fixed, and so now you're providing that service as well.
Yes, yes.
So what can you tell somebody who's watching this right now that might be reluctant to give you a call? What could you tell them? How easy it is? What can you tell them?
Yes, just go ahead and call the number on the screen and just come down. We give you free consultation. That way we can start helping you today with the smile.
So tell me about the work that you can do inside your office, inside that lab.
So what we have is that we have an in-house lab. We spend hundreds of thousands of dollars on technologies.
So as far as the technology that's in place right now at your office, is that common for other dentist offices to have that?
No, 99% of the dentists don't have it because it's very expensive.
It's expensive. Is it cost effective for the patient to come to your office because you don't have to outsource that service?
Yes. So the good thing with the in-house lab is that we don't have to pay the middleman. So we don't have to put that cost on the patient. So we keep the cost low for the patient too.
And I guess I would assume that it's faster as well.
Yes. So that way we can give patient teeth immediately.
So tell me about those technology tools.
So we have the program that we can take the picture of your smile right now, and then the before and after pictures. That way you can see how your smile look before we actually do surgery on.
Okay, so that's amazing. So I can actually see what my smile is going to look like before I actually have this procedure.
Yes.
Okay.
We make sure you approve your smile before we even do anything.
So I'm like my own quality control check.
Yeah. Yes, you tell us what size of teeth you want, how small, how whichever way.
And you'll do that there at the office?
Yes.
Gotcha. So if I wanted super bright white teeth, I could get that.
No issue.
No issue.
Yes. I've been at the practice since 2009. So it's more than 15 years.
15 years in practice in Fort Worth.
Yes.
Wow. Wow. So what kind of surgeries do you do?
I do all kind of treatment procedures, but I love most is the implant. That way I can give patient permanent teeth and they can chew and eat normally. That way the teeth don't fall out, or when they smile or when they talk, they don't come flying out. So I love to anchor the teeth into the jaw and it's more permanent solution for them.
Sure. So what's a moment that you can remember that it was a life-changing sort of experience for a patient?
One time this patient comes in and he has no front teeth and he wouldn't smile. So when he smiles, he always cover his face, his mouth. So and I able to put implant and give him teeth the same day, and he was very happy about it.
So you did the implant and you gave him teeth the same day?
Yes.
Wow.
Yes.
So he came in, didn't have the teeth, and he left your office that same day with 2 front teeth.
Yes. So he able to talk and smile and get his confidence back, and it's very life-changing moment for me.
Sure. So do you see a lot of patients that are embarrassed about their smile and about the condition of their teeth?
Yes. I see a lot of patients that comes in and out their teeth broken down and they can't eat properly or smile, and they in pain too. So
Sure. Is pain a big factor for a lot of these patients?
yes, a lot of them in pain, and that's how they come in because they don't have money to do treatment. So when they come in, I find ways that I can help them, and payment plan or anything to help them get their teeth treated.
So, and tell me about the payment plan. How does that work?
So we have different payment plan. We check the patient and see what they afford each month. We cater to each patient. They have different budget. So and then we come up with a treatment plan that can best fit their budget.
So how often? So this is on a monthly basis.
Yes.
Okay. All right. So would you say that this is about the same expense as a car, or less than, or a credit card? What would you compare it to?
Yes. It's less than a car, but then you use a teeth more than your car. So if they have bad teeth, they can't eat properly or they can't smile. With good teeth, they can chew better, and they have better life, and their health get better too, because then when they can chew food properly, then the health improve.
How does the patient feel after they've gotten this procedure done and they've gotten this surgery done? How do they feel? Confident?
Yes, they feel like a different person. Their facial changes and they look younger. Because when they have no teeth or missing teeth, their face kind of stacking down and they look very old. With teeth, they look younger and they smile more, and they can eat, and they go on with their life.
Sure. Yeah. So it's like getting Botox.
Yeah, it's just like a makeover kind of thing.
Right. So how is your office different than most other dental offices?
Good question. Now, our office, first, I treat my patient like my own family member, and I find a way to help them. We have in-house labs, so that way, we can design the teeth the way the patient wants it, the color and the teeth, the shape, to make the patient happy.
Right. So you got the digital technology in your office, in your lab, that you're able to create these new teeth to put them in the same day.
Yes.
Sure. Is that a complicated process?
Yes, it's very involving. So to me, when the patient come into my door, they're all nervous and worry about the teeth and about the pain. But by the time I'm done with them, they walk out of my office smiling, and having their life back to normal is very rewarding to me.
Sure. Yeah. So you've been doing it for a long, long time.
Yes. Actually, I started since 2003. So I'm very passionate about it, to see my patient happy and be able to eat and chew.
Right. So are you a full service dental office? You do the implants, of course, you do the surgeries, but you also do cleanings and root canals and bridges and all that?
Yes, we do everything at my office. We do gum treatment, we make them teeth, bridges, partial dentures, implant, all and core. Everything that we do at the office.
Right. Yeah, you had mentioned that before. The was it RN4?
All in four.
Yeah.
Yes.
Yeah. What is that?
So what happened is that patient come in with no teeth or their teeth are really bad. So we take out the bad teeth and then we put in implant. So it's like an anchor that go into the bone, and when we screw the teeth on top, patient can't take it out. It's more permanent, but we can. And that way patient can chew like they normally have the teeth.
Right. So what is the recovery time from doing that? Because that sounds involved.
Yes. So the recovery time is around 3 to 4 months to completely heal. But when they have the teeth, we can give them teeth the same day. They can go and eat soft food.
Soft food.
Yes.
Yeah. Like what soft food?
Soft food, anything if they can cut with a plastic spoon. So if they cut in the plastic break, and that's too hard because the body needs time to heal. We don't want to put too much force on those implants that's not healed yet.
Sure. So are they able to eat that same day?
Yes, they can eat the same day as long as they eat soft food. Yeah, wow. I think too hard.
Yeah. So they're able to get a new smile and they're able to eat something the same day.
Yes. Yeah. So that's very excited, and my patient, they loves it.
So what was the average age maybe the age range of your patients?
The average age between 25 to 70, 80 years old.
They're right now.
Because a lot of those patients, they struggle the whole life because of their teeth. And we finally able to come up with a solution that can help them with permanent teeth so they can eat better.
Sure. What would be the difference between somebody getting the implants and somebody just needing dentures?
First of all, it's the price. The denture is cheaper. But the thing with the denture is that it covers a lot of the palates, so patient can't taste food very well. And sometimes if they don't have enough bone, nothing for the denture to hold on, so they have to use denture glue. But with the permanent implant, the teeth got screwed in. We anchor the teeth into the bone so the patient can chew better. It's more stable type thing.
Now that sounds scary. So as a dentist, what can you do to help me not be so fearful?
Yes, I understand it sounds scary, but we have nitrous and oral sedation that we can sedate the patient. So when they come in, they stay calm and we can do the work.
So I don't necessarily have to be awake for any of this, right? I mean, so what is that? Am I completely under, or how does that work?
So first we talk to the patient. We go through with them about how things goes, and then we have nitrous and then oral sedation. That way we can help calm the patient down. So the patient like in the twilight stage where they can't remember things. So by the time, 2 hours later, they wear off, and then we'll be done with the surgery then. And they wake up.
Yeah. So when you say they wake up, they
are aware. Yes.
Gotcha. So it wears off.
Yes.
So that you don't have to give them something else to come out of that state.
Yes. The medicines just wear off, and then they become aware again.
Right. So do they need somebody to drive them home?
Yes, they need a driver because they're drowsy, and then it's a big surgery, so we don't want them to drive.
What percentage would you say of your patients get the implants versus the dentures?
The majority of my patients love the implant better because it's more like a replacement for their teeth. The denture is like replacing what they don't have in their mouth right now, but with the implants, it's more permanent, so it's more replacing of your teeth that restoring the function how they were before with the teeth.
So would you say, as far as the motivation for the patient, would it be because they can't eat, or they're in pain, or they want to look different, they want to feel different, they're embarrassed? What would you say?
Yeah, it's a combination of all those factors. A lot of time they can't eat, and then without teeth, they look very old. And a lot of time with the denture, it doesn't fit well. They're in pain too. So
One of the reasons why a lot of people don't go to the dentist is because it's scary and they're afraid of the pain. And what would you say to those people?
nervous patient, we walk them through each steps of what we're doing, and then with the nitrous and the sedation, and that helps them go extra mile.
So the patients that are getting the implants, those patients, do they need some help in understanding really what's going on? I mean, would anybody know that they need an implant before you tell them?
A lot of patients, they don't know that they need it. They just thought, they struggle is normal, like the dentures. But by the time they come in, we explain to them the steps. And with the good and bad with the implant or the denture, when they understand, then they can get better informed of what route they want to take.
Right. Do a lot of your patients also have gum issues?
Yes, a lot of these patients, they haven't been to the dentist for a long time. So they have a lot of build-up and a lot of bone loss. And their teeth fall down. And that's when they need the implants.
So tell me a little bit about your office and your team and the transformations of some of your patients.
We have some before and after pictures that we can show, the happy patients. And my team, we always have training with them. We make sure they know what they're doing and make sure they know what to tell the patients, explain the procedure to each patient.
So how do you prepare your team? I mean, a lot of the times I've gone to the dentist and they don't even remember who I am.
Yes, that's a good question. In the morning, we start at 8 o'clock. We have an hour training to our team members. We go through the schedule and we make sure we understand each and every of our patient, what they need. And so by the time the patient comes in, we know what the patient's needs and wants, and their goals is for their visit.
Sure. So of the patients that are coming to see you after they've had their implants, they're coming in for service of some sort, or coming in for cleanings, or?
With the on-4, after the implants, we recommend every 6 months they come in, and then we take out their teeth, and then we clean it for them. That way they can keep the implant longer.
Oh, I see. So how long does that take?
Like 30 minutes.
Within 30 minutes. So they
30 minutes.
Kind of like a normal cleaning.
Yes.
Right. So if you have your teeth, you're coming in to get your teeth cleaned every 6 months. And same thing for the patients.
Yeah, it's just like a maintenance for the car. You have to have oily change all the time. Sure. So the same thing with the implant. We have to take it out and make sure we clean it and maintenance it.
As far as the implant is concerned, does it last 5 years, 10 years, a full lifetime? How long do they last?
As long as they keep up with the schedule of cleaning, it should last them for a long time.
Interesting. How long do dentures last?
The dentures, usually denture, we recommend to change that every 4 to 5 years.
So you spoke about new technology. Is there new technology happening in your office?
Yes, we have different technologies. We can scan the teeth instead of taking impression. And we have program that we can design teeth. So we have a 3D X-ray that we can look inside the bone and see how thick the bone is, and where are the vital structures like nerves and sinus before we put in the implant. And then we have scan machine that way we can scan your mouth, and we have that way we can design your teeth properly.
Well, that's fantastic. Wow. So all of that is done in your office. You don't have to outsource anything.
Yes, all that done with in-house. So that way we don't have to pay the middleman, and that way we can keep the cost down for our patient.
Oh, I see. So it also helps drive the cost down by having everything inside.
Yes.
That way you don't have to send it out to another lab and pay them.
Yes. So we keep everything in-house.
So for the people that are watching this program and they're reluctant and they're hiding their smile and they're embarrassed, what would you say to them to motivate them to get off the couch and to come into to your office for a consultation?
Just go ahead and come in, and we have free consultation. It doesn't cost them anything. And that way we can come up with the right plan and the right treatment for the patient.
As far as the right treatment is concerned, how long does it take typically for you to determine what that right treatment would be?
By the time the patient comes in, we do X-ray and we check to see what is right for the patient, and we go over a payment plan, everything. So it's like an hour, 30 minutes to an hour.
Yeah, they don't know what they need. They just know that they're in pain or they're embarrassed, and you know what they need within that.
Yes.
Tell me a little bit about your personal journey. How long have you been a dentist, and why did you get into it?
I've been a dentist since 2003, and I got into it because my grandma doesn't have teeth, and I saw her always have to struggle eating and chewing. She always have to grind up her food. So that's motivate me to be a dentist.
It's a very personal reason to become a dentist. Have you always practiced in Fort Worth?
Yes, I've been practicing Fort Worth since 2005.
We were just talking about Smile Design. What is Smile Design?
So the Smile Design is that we have a CAD/CAM program that before the surgery, we design the teeth, and you actually see how the teeth look before we do the surgery, proceed with the surgery.
So you'll actually design the teeth before they even go into surgery?
Yes. So that way, they know what they're expecting and how the teeth looks. And then we'll do the surgery.
Wow, that's very interesting. So once the teeth get in there, they already know what the teeth look like. That's unique. Do other offices do that?
Yeah, and most of the offices don't have that program yet, but we have at our office, so a lot of my patients like it.
So explain that to me, how that might work. So in my head, I'm thinking that I'm looking at a screen, and you're like putting my teeth into my mouth so I can see my smile. I can see the way my face looks. Is that what we're talking about?
So the Smile Design is that we take a picture of your smile, and then we sit down with you one more time, and we show you the before and after pictures, and make sure you're happy with how your teeth looks and your new changes even before we do your surgery. So you're able to see how you actually look before we actually do the surgery on you. Like how your teeth looks, the size, the shape, and the color, and everything. So that's the beauty of the CAD program, the CAD scan program, that you're able to design your smile before we do anything to you.
I see. So other offices have this technology, or other dentists have this technology?
No, 99% of the dentists don't have this technology, and we spend hundreds of thousands of dollars to make sure we have the cutting edge technology and keep our patient happy.
So do you have some before and after photos that you can show us of these transformations?
Yes, we have many before and after photos of our happy patients. So we have patients coming and they have no teeth. And after 24 hours, after a day, they can come out with teeth and they're super happy and they can smile and eat. I have a videos of this patient that he came in with no teeth in the front and he wouldn't smile. And he's in his 30 or 40. And after we do the surgery, he come out with a brand new teeth, and he looked very young now.
Sure, and that's the implants.
Yes,
The implants.
so on for the permanent teeth, and it replaced his old teeth that he's not happy with. So I remember that it's a patient came in and he has no front teeth, and he would smile, and he's very young, and he say he doesn't have a girlfriend either. Yes, because he's not confident with his teeth. And after less than 24 hours, he come out with teeth, and he all smiling and go on his own, go on his day.
Yeah. How did that make you feel?
It makes me feel amazing. All this hard work that I've been, studying, it worth it, because it gives patient the happiness back. Yes, he's happy now, and he's married, and he's meeting new people.
Can smiles really affect you like that?
Yes, because imagine they're not smiling all day, and they get depressed and everything. So yes, when I see him getting his life back, go out socializing and getting a wife, it made me feel very happy.
That's awesome. Yeah, tell us a little bit more. Do you have other cases that you can remember that had that same sort of effect on you?
Yes, I have cases of this guy. He lives in Houston, and he wouldn't trust any dentist down there, so he would drive up to me so I can fix his teeth.
You drive all the way to Fort Worth.
Yes, he drive all the way to Fort Worth for me to fix his teeth
Wow. From Houston.
from Houston.
And he just didn't have anybody down there that he trusted as much as you.
Yeah, I told him that it's so far of a drive. Why don't you find someone down there? But he said we wouldn't trust them.
Wow.
Drive all the way up.
So how long did that go on? I mean,
He would commute. Even now I still see him.
you still see him.
Yeah. After I fix his teeth, he still comes to me every 6 months to have his.
And did he have the implants?
He has implant and he has bridges.
And he has bridges. So he has implants and bridges, and he comes to you to do the service that you had mentioned before.
Yes.
And he drives up every 6 months. to come and
Yes,
see
he
you.
drives up. And he getting old now, so he get his daughter to help him drive.
Wow, that was a great story. If you're watching us now, I'm sitting here with Dr. Doe, and she is a dentist in Fort Worth, and she is doing incredible work even for patients in Houston. So tell me a little bit more about the patients that continue to come back to you time and again, or that refer their family members or friends to you.
Yes, I have many of those patients. They come to me and they refer their family member to me.
Right.
I have a lot of those.
Because you treat your patients like family.
Yes, I treat them like my own family member.
Tell me more about your experience growing up with your grandmother. How did that impact you? I mean, you felt a calling. You saw your grandmother struggling with her not having any teeth, and you felt that you wanted to help her, and by extension, helping new patients. How does that make you feel?
Because when I grew up, I saw her always have to grind up her food to eat, and how much she struggled, and she gets super skinny because she couldn't eat properly. So every patient that I service and then they're happy and they're able to eat and function properly, it's very rewarding to me.
So it impacts their health beyond just their facial structure. And you're located where in Dallas, Fort Worth?
So we locate in East Fort Worth near I-20 and 820.
What's the best way for somebody to reach out to Miller Dental and get a free consultation?
They can call the number on the screen, and then they can take a photo of the QR code, and we can set up an appointment.
You can either call the number on the screen, or you can just point your phone at that QR code, and I'll take you right to their website. This is a fascinating conversation. I'm sitting here with Dr. Doe of Miller Dental. And let's talk about another one. Can you give us another example of a transformation that just, made you feel fantastic?
Yes, and I have another patient that he has all his teeth in the bottom missing. He had no bone. So he been trying to wear the denture, but he's keep on cutting his gum and his bone and his tissue, so he couldn't eat. So we're able to give him another on4, which is a permanent teeth, and he able to eat and chew normal.
Well, so that's the implant surgery that
Yes.
you're talking about.
Yes.
Now, did he do the sedation?
We would recommend sedation. We do oral sedation.
So for the nervous kind of patient like myself, I guess it would be, I wouldn't feel as though I was there for a half an hour procedure or 45 minutes or whatever it is. I would feel like I was only there for 3 minutes, 5 minutes,
Yes.
something like that.
Yeah, by the time we put the medicine under your tongue, and and then by the time you wake up, the whole thing is over.
Right. So I'm not unconscious. I'm still conscious, but I just don't remember all of the things that are going on.
Yes. For a nervous patient, you wouldn't remember anything.
Well, that sounds fantastic. Sounds like I want to do that right now.
No, your teeth.
So what's the difference between the nitrous and sedation?
So the nitrous, you're still aware of what things happening around you. So the sedation we do is the oral sedation, which like you in the twilight stage. By the time you wake up, you won't remember what's going on. The procedure.
I like that. That sounds like my kind of dentistry.
Yes, and you have your teeth.
Right. I am sitting here with Dr. Doe. She's telling me amazing stories. You can find her at Miller Dental, near 820 and I-20
Yes.
in Fort Worth.
Yes.
Right.
Yes.
And if you want to get in touch with them, just call the number on the screen or take your phone and just hold it up to that QR code. It'll take you right to the website.